now complex regional pain syndrome. Previously, I've known it as RSD, which is reflex sympathetic dystrophy, is what I learned it as. But now the new term is complex regional pain syndrome, and it's usually intense pain, usually in upper lower extremity. And typically the patient presents with a lot of pain, not wanting to use it. And in my experience, I've seen it after some type of injury.
Regional pain syndrome causes the central nervous system to dysfunction, so it becomes completely overactive and starts to constantly send pain signals to the brain. It's unclear what triggers CRPS. It's usually an injury or trauma, but the pain becomes so overwhelming and completely disproportionate to the injury that triggered it, and the pain will continue long after the injury has healed. So it's this misfiring and overactiveness and dysfunction in the central nervous system that makes CRPS complex.
Complex regional pain syndrome was my past and my future. I battled CRPS for 3 years, and luckily I was able to be cured. But as a future physical therapist, I will see many more CRPS patients in and out of my office every day. However, curing them will pose a new challenge. Because complex regional pain syndrome has no known cause, there is also no known official cure. When I was 8 years old, I felt pain in my ankle. My doctor told me he couldn't see the damage and that I should just take pain medicine and hope the pain goes away. The next year, the pain grew up from my ankle to the back of my knee. Again, my doctor's like, well, I think your muscle is inflamed, but I don't know what's wrong with you. Take pain medicine, hope the pain goes away. A year later, the pain had grown from my ankle and wrapped around my entire leg all the way up to my hip. Not only could I barely walk with my right leg, I couldn't sleep on the right side of my body. I couldn't wear tight jeans because the constriction of the material against my leg was excruciating. I remember complaining to my mom on a windy day that when the wind would blow against my leg, I felt like pins and needles. Although I was in extreme amounts of pain, for some people, their symptoms were much greater. The McGill Pain Index is a tool that doctors use to compare and measure a patient's pain. The patient is asked to rank their pain on a scale from 1 to 6 in categories such as, does the pain pulse, does it jump, is it a sharp pain or a burning pain? Due to numerous patients in different agonizing scenarios answering this questionnaire, it shows that complex regional pain syndrome is the most painful ailment known to medicine. It ranks above childbirth and even above amputations. CRPS ranks a 42 out of 50. Although I was lucky enough to be cured of CRPS, many patients are not. They will battle complex regional pain syndrome for 10, 20, even 30 plus years of their life. For these patients, therapy just doesn't cut it for them. As a future physical therapist, I will work with every CRPS patient I have and hope that physical therapy will be enough for their cure. But until then, I encourage you to join the fight with me to find a cure for complex regional pain.